The convergence of telemedicine, personal health tech, and AI. I'm Tonya Hall, and joining me is Dr. Jason Hallock, Chief Medical Officer, SOC Telemed. Welcome, Jason.
Thank you, Tonya. It's
What
great to
is
be here.
SOC? Well, yeah, of course. What is it that you do at SOC Telemed?
Well, at SOC Telemed, we started in telemedicine as a physician practice about 15 years ago, providing critical specialists to hospitals that need them when they're in short supply. It started with teleneurology. It moved into telepsychiatry shortly after that. And in the last 5 or 6 years, we've added telecritical care, which is having great importance during coronavirus. But we realized about 5 years ago that there wasn't a system out there that could match the patient's needs to the most appropriate available doctor real time on either a regional level or at national scale. So we had to go out and build a technology platform to be able to do that. It serves our physician group now, but also serves many other hospitals, health systems, and physician groups around the country, matching the patient's needs to the specialist needed real time.
Give us a brief overview of your vision of telemedicine.
Well, I think if you look back, I'll use an analogy with the first movies. At first, theater was done on a stage, and in the first black and white movies, they basically took a camera and put it in front of the stage and filmed what was going on there. And then they realized, hey, we can move the camera around and we can do different things, and movies got really interesting. And now you see everything that's done with CGI, and it's just completely different. It's much the same way in telemedicine. It started very much as a point-to-point interaction. Then through the availability of mobile carts and other technology, doctors are able to go just about anywhere in the hospital and into patients' homes. Now the piece that's coming into play that's going to really be a game changer and keep us healthy is the interaction of wearables and home health technology, as well as artificial intelligence and predictive analytics. Artificial intelligence could be, it's already being used in critical care settings to predict the patients that are the sickest or are at risk of getting sicker so we can intervene earlier. And it's doing the same thing at home with wearables. If you can upload that data where it can be reviewed, first, through some automated, intelligence, be reviewed to predict who's at risk for getting sicker or need an intervention, and then be able to make the interaction between the patient and a nurse or a doctor, whoever they need to see. That's where it's really going to change things in the future.
What steps do you see healthcare industry as a whole, and maybe even the consumer tech industry, have to bring this closer to reality, to make this more of a real thing that we're in need of right now, in fact?
Well, in the past, a lot of this data, existed in silos, and now with interoperability, if you can share that data with the right entity, you can get the help you need or intervention you need, or even connect with doctors when you would need to, based on trends of either your heart rate's going up or blood pressure's changing, and that can notify your doctor or an available doctor. And so really, once systems talk to each other more in a defined manner is when we're able to really change outcomes for patients.
Will government regulators play a role in any of this?
Well, they will. The first is, we really need better access for patients, with broadband and things like that to make a lot of this happen. That's changing. The ability for physicians to practice across state lines is something that's changed during COVID-19. But post-COVID, we're hoping for more of a national licensing standard that allows doctors to help more patients without these artificial state walls that exist today. But what we've seen is telemedicine is really, in the last 2 months, based on the COVID-19 crisis. It's really tearing down the four walls of the hospital, and it's also torn down the four walls of doctors' offices. But we need the support of the government. Also, they legislated payment for services which largely hadn't been there before.
Will HIPAA regulations, will those need to evolve also?
Not much. I think a lot of the temporary HIPAA restrictions that were dropped were based on video technology. But right now, nothing is typically recorded on either end. But where the information travels through with data and servers is got to be HIPAA compliant. So I think as we come out of this, many companies providing video technology will step that up to make it more HIPAA compliant. Patients are very comfortable using it and have very little concern that their interaction, as long as they're assured it's not being recorded, would be used anywhere. But I think some additional things will need to change post-COVID.
So when might we see this convergence actually begin, or has it really already started?
Oh, it's definitely already started. Many patients of all age groups have wearable technology and are learning how to use that. Right now, they're able to share that information with their doctor, but it's really written down or printed, or I'm a practicing emergency physician also, and they share it with me all the time. What's going to change is it'll directly be able to go into their personal health record, and no one's going to have to look at it or write it down. It'll just be there for the doctor when they see the patient. And that's happening now, but I could see within the next 1 to 2 years, that's really going to explode.
Dr. Jason Hallock, Chief Medical Officer, SOC Telemed. If somebody wants to connect with you, Jason, what's the best way they can do that?
They can certainly go to our website, soctelemed.com, and you can access me or members of our team there.
Thanks again, Jason. And find more of my
Thank you.
interviews right here, or go to tonyahall.net. Thanks for watching.